This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome. It's another edition of Health Watch right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. As always, here on the program, we talk about the who, what, when, where, why, and how of Innovative Medical Associates. And yes, we'll answer your questions as well. 855-839-1210 is the number here in the studio. 855-839-1210. Anytime during the course of the show, if you have a question or a medical challenge that you want to run by Dr. Molly, feel free to call in at 855-839-1210. It's always the same. Dr. Molly, we start off the show. And, well, what do you do at Innovative Medical Associates?
Yeah, no, it's hard. It's hard. So it's pretty simple, actually, when we think about it, John. So what we are is a group of like-minded healthcare providers, and they all work out of my licensed primary care facility in Marlton, New Jersey. What separates us, I guess, from the pack is our philosophy. We like to use the least amount of pharmaceutical for a patient so that the side effects of the pharmaceutical don't impede their quality of life along with whatever's bringing them to us in the first place. So that's it in a nutshell, I think. So we use things like vitamins, minerals, amino acids, that kind of thing. The other thing that separates us is that we have a full hydration clinic with this, meaning we like to use hydration as the vehicle to deliver those natural products for a patient because we're able to actually deliver a therapeutic level for them and hopefully affect the change that we're looking for without, again, impeding their quality of life.
And it goes right into the bloodstream.
Oh, yeah.
Right?
Here's our problem, John, with everything we take, and this includes medication. How much of it do you think you really, really take?
Probably a little bit.
A little bit, probably 30%, somewhere between 30, maybe 50%. Depends on how tuned up you are, which, we see people come in. And it's interesting. Lots of the folks who come to us from the very beginning have digestive problems. So this is why, from the very beginning, we looked at this as a viable option to help people through their journey with whatever challenges they have.
People always ask you, and I always ask you at this point of the show, do the natural products work?
Sure.
Because we're conditioned that prescriptions work.
Yeah.
So
and
does
many
this work?
times, and listen, you'll never hear Dr. Molly say, throw out your prescription meds. Won't do it. Okay. We know that when you have a need for prescription meds, you've got to take them. The question is, at what point in your treatment protocol do the prescription meds maybe cause some more problems than you had when you went in for the prescription meds? You alone, we must have changed blood pressure meds. Dr. Casca and your specialist changed blood pressure meds at least 3 or 4 times.
Oh, yeah,
that I know
definitely,
of, right?
Definitely.
Because sometimes the symptoms you were having wasn't related to the hypertension, but related to the prescription med. So again, what we want to do is we want to work hand in hand with the prescription med, and we do that by utilizing the natural substances.
And a lot of times that happens where you get a prescription and it's not appropriate for you.
Or it's worn out its welcome,
right?
It's worn out its welcome, and therefore then you need some advice. And here's the same thing. That's true with natural substances too. In other words, you want to go to a place that is medically hydration, which is what we do, because we're looking at the hydration ingredients, which are natural vitamins, minerals, amino acids, things you get in the health food store, but we're looking at their constituent in that actually has the medicinal property, and you want to use that judiciously.
And, you know, speaking about medications and prescriptions and natural products and so on and so forth. You were telling a patient, I heard you telling a patient the other day, and this is really, people just take things.
Yeah.
And you know,
Aunt Matilda gave me this. Uncle John gave me that. Right?
Yes.
No.
They
Don't do it.
Shouldn't do that. You should get advice before you do it.
Not only that, I mean, look, let's face facts. There can be interactions between the natural substances and these your pharmaceuticals. So guess what? You don't just go out and remember, I want people in a medical hydration facility. We're treating natural products like they are medicinal, which is what they are. Therefore, we want you to utilize things that we know and like and know they will do the trick, whether it's oral, because, you know, many of my patients, you're one of them, are on oral nutraceuticals as well as the IV nutraceuticals. So what do we want to do? We want to use them properly for the patient and make sure they don't interfere with the traditional drugs, but maybe enhance your outcome. That's the whole point. We want to enhance your quality of life.
What are some of the, and I know you use a million products, but what are some of the key products that you use that effectuate change?
Well, I can tell you that amino acids, when used properly, can effectuate change on liver. We've seen that. We've used things like glutathione. We've seen using alpha lipoic acid for folks who have diabetes. And again, I absolutely am sure, and I have the data to prove it, that utilizing even those two items, using them with the hydration, effectuates the change much more quickly than taking them off the shelf.
And a lot of times people come in, and I've heard this, they say, I've had 2 treatments, and I feel so much better. And it's really amazing.
It's not placebo. You can't listen, John. You sit in there. You're there Tuesdays and Thursdays. When you're in there, you see the clinic, right? And people are talking to each other. Now, of course, I probably am going to get slapped on the hand for a HIPAA violation, but that's not because we don't believe in HIPAA and don't encourage people to be HIPAA compliant, but patients love to talk to each other.
That's right.
And that's it. I mean, this is look, our listeners, our listeners are highly educated.
Yes.
Right?
Yes.
And they talk about their journey, and there's no way we're going to take their minds with placebo. I'm telling you. It's still to today. It makes me stop and take a step back and say, wow, what a group of patients we have.
Yes, we really
thinking
do.
people.
You do.
Thinking people, and that's great.
Which leads to the question, does this work?
It does. It does. And I would say that we have qualitative and quantitative data to support that. Qualitative be, hey, I'm walking more. I have less pain. I have less brain fog. And then we have the quantitative data that says, oh, look at the change in the viral counts. Look at the change in their cholesterol. Look at the change in what's going on with the liver enzymes. So there are ways that we do this. Oh, let's send them out for a cardiac situation where we can measure cardiac output. Guess what? The echo shows, wow, look at that improvement from 6 months ago. So again, we have the data to show this. And that's why I am very well entrenched with delivering the hydration in a way that's medically sound.
And you constantly monitor
patients. There's no question. I mean,
and you're tweaking the
of
bags
course,
and
of
all
course.
of that
Look,
stuff.
last week everybody said to me it looked like a rainbow in there because it was so different. Because I had some people midway through their treatment protocol, I had others that just started, and then 2 completely different treatments. We had a myriad of people in that clinic on Tuesday and Thursday, and it's been like that this whole week.
So, you know, it does work.
It does work.
And
it does work. How quickly? That's going to depend on how quickly you get in to see us. We all know that if you're running around with stage 4 cancer, guess what? You know, that's going to take a little longer than if you come in right after the biopsy and it's only a 1A.
We are coming up on our first break of the morning, and the show is called Health Watch, and we are here every Sunday between 8 and 9 a.m., right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. And we always tell you at this point in the show, you can call early because we want to make sure that we get to your call because it happens every week. Some people call at 2 minutes to 9. We can't do much for you then. 855-839-1210 is the number. Again, it's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. We're coming back with more of today's edition of Health Watch after these words. We are back here on Health Watch, and as always, when we are on the air, and even when we're not on the air, operators are standing by at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. When you call, all you want to do is schedule the initial consultation with Dr. Molly. It is complimentary. You will learn a lot. You will actually see the clinic, and believe me, it'll be worth your while. 856-489-0505 is the number, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Before we get back into the program, we're going to talk to Hal in Maple Glen, PA. Hal, good morning. Welcome to Health Watch.
I'm going to be on the air. No worries.
Hi, Hal. Turn down that radio. How are you, sir?
Please. Thank you. Hi, Dr. Molly. I appreciate being able to speak with you.
No worries.
Calling on behalf of a relative who has cancer, is under treatment by a prominent local cancer organization.
Great.
And just found out that localized treatment for melanoma was not successful to what they want, and they're going to change protocol and go to infusion type therapy.
Sure.
So, just reading the consequences, the potential side effects of that, and things that you regard. The relative is older, so just would appreciate your thoughts. I don't have the specific medicine, but there is a specific medicine which I saw, and just is someone, let's say, too old, and it is an advanced stage.
Yeah. It's interesting. I have to tell you that it's interesting because melanoma has become quite prevalent in our area, which is interesting, right? We're not on the equator or none of that, but it is around. In fact, one of my nurses actually had melanoma, and it was also treated at a very prominent local, large organization hospital, and she did very well. They removed the melanoma and this and that. She actually she's younger than what you're talking about. I assume your relative's closer in age with me, probably 70 into 70.
Much older than that, Dr. Molly.
Oh, my God. Oh, okay. So, I think he has to weigh the risk versus reward. If they removed all of the melanoma, the areas that had the melanoma, what is the oncologist telling him? The other thing is sometimes we have to use common sense. But this, I'm not against anyone doing chemo, okay? But there can come a point in your life. I got to tell you, when you're 85 or 88, John and I talk about this all the time, right? And you're looking at possibly having, 15 rounds of some type of chemo. You got to be in great shape. You got to be like Jack LaLanne, you know what I mean? Right? In order to get through that.
Let me interject if I can, Dr. Molly.
Sure,
it's not. Thank you. It's not chemo, is what we were told. It's something called infusion therapy.
It's immunotherapy. Okay, it's immunotherapy.
I'm sorry. Yes,
right.
I used the wrong word.
Well,
Immunotherapy, not chemo.
yeah. Well, let me just say this, okay? It's our experience, and that means I'm including my physicians, that the side effects on immunotherapies that are infused immunotherapies, as well as the oral immunotherapies, can be just as caustic as chemotherapeutics, okay? And maybe in some cases worse, because they actually have to desecrate the immune system for these things to work for the most part. And of course, if you read all the side effects, I mean, I think he has something to think about. Certainly, it's worth tuning him up. I mean, making sure nutritionally he's able to withstand that. And God bless him on his journey, because, again, I don't say don't do what your oncologist tells you to do, but I do believe we can augment that. And we're going to talk about a case a little later that we are doing just that. Thank you for this call, Hal.
Okay,
God bless you.
Thank you. Thank you for the call,
and God
Hal.
bless your relative.
Mayor of Germantown, Joe is on the line.
Hey,
Joe,
Joe.
good morning.
Hey, Joe.
Good morning, John. Good morning, Dr. Molly. Good morning to your wonderful producer, Kirk. You know, Dr. Molly, I want to say a couple of things real quick. First off, you're Italian, right, Dr. Molly?
Oh,
Yes.
yeah. Don't hold it against me. Now, come on, don't hold it against me.
Are you kidding me? Let me tell you something. About 2 weeks ago, I meant to tell you and John this last week. I didn't get a chance to call. A good friend of mine, Italian girl I used to work with, a good friend of mine, co-worker. I went to her daughter's wedding over in Pittman, New Jersey, about 2 weeks ago. And her, man, it's something about Italian. They made me feel like I was part of the family, man. Seriously, I mean, they made sure I ate too. They would emphasize eating, and the food was so good. I mean, at the reception after the marriage, and we had the reception. It was because she got married on the golf course by the lake, by a little river, lake or whatever. Like, it was like the scenery and ambiance was just so fantastic. But my point, Dr. Molly, is her family, her mother, father, sisters, and everything, uncles. I mean, they treat me so nice. I feel like I was part of the family, man. I mean, that was one of the best. And I went to a lot of marriages in my life. That was probably one of the best top 2 or 3 marriages I ever went to in my life. I mean, it was just the people. They made me feel so warm there. I just wanted, and I never forget that night as long as I live, Dr. Molly.
God bless you.
It was so beautiful, man. It was so nice,
Hey, Joe, we're John and I are both Italian, so we understand this, right? Bonanza. We got to do it right. That's what we do.
That's right.
That's what we do.
I forgot John was Italian. I forgot John was Italian. You're absolutely right. I mean, they treated me so nice. I had a wonderful time. And Dr. Molly, on the previous show that came on before you and John came on, Dr. Levy made a good point and stuff. And see, he's one of the few ones that's not that he do got some open minded, because, like I said, you got some doctors and some of these people they so down on supplements and alternative medicine. And he said, well, it's good that because he told the guy, the host, he said, you have to take these things. He said, because no matter what kind of diet you have, he said, and like you, Dr. Molly and John, I try to eat a balanced diet every day. I eat my good portion of fruits and vegetables. But like Dr. Levy said, you may not get it all, so that's why with the supplements. That's why they call them supplements, because you might be deficient or short on this one right here, and the supplements, the vitamins, the supplements, the herbs, they help them fill in the gap right there. So that way you keep your body in fine-tuned shape and everything like that. So that's why supplements and vitamins and all the things Dr. Malik, you and John be recommending, people need to follow that, because that's what keep your health, so optimal health. It's just like a car. If you put the right gas and oil in your car, you keep it maintained, you'll be good. And your body works the same way. And that's why I applaud y'all for doing what y'all doing and stuff like that, because y'all try to give the people the best health advice in the world. And, hello to Frank, my friend Frank from the Northeast PC listening, because y'all do the right thing, and I appreciate y'all. I do. I really do.
Well, God bless
thank you for the call, Joe.
God bless you, Joe.
You made us hungry.
All right. God bless you.
Love y'all guys.
Okay,
right,
thanks for the call, Joe.
Thank you.
855-839-1210 is the number here in the studio, and we are coming up shortly on a break. But we'll get started with this. You wanted to talk about vitamin D toxicity.
Yeah, it goes into keeping what we were talking about earlier, John, about people who go and they ask Aunt Matilda and Uncle John what to take, and maybe it interferes with some other things, or maybe they start to take too much. Everybody knows Dr. Molly loves Goldilocks, right?
Yes.
Just right. And that includes something like vitamin D in particular. Vitamin D, not many supplements can cause toxicity like vitamin D can. So vitamin D we really have to worry about, because if you have a very, very toxic dose of vitamin D, large amounts in the supplements you're taking, and then let's say you go in and your doctor gives you a vitamin D shot or whatever, the main consequences of vitamin D toxicity are a buildup of calcium in your bone and in your blood. And you know what causes nausea, vomiting, weakness, frequent urination? It can progress to bone pain and kidney problems, including kidney stones, that we always think is just vitamin C is going to give me the kidney stones. Many times I find out that the patient who has the kidney stones is on the verge of vitamin D toxicity. And the patient that I was talking to was a good indication of him taking too much vitamin D along with what we were giving him in the clinic. And this is why it's important not to just go out and start taking, 60,000 units of vitamin D because somebody in the family told you how great it worked for them. Yes, vitamin D is a wonderful supplement, and we need to be monitored while you're taking it, and you want to be in a place where there's medical hydration. This is the kind of facility that can monitor how much vitamin D you're getting and make sure that we're not putting you into a situation where we have toxicity occurring rather than the good that the vitamin D can do overall.
Too much is not good.
I say it all the time. Not too little, not too much. You better all subscribe to Goldilocks, and that's true with everything we do.
Yeah, people think that, well, I can take that. It's a natural product.
Yeah,
but it's not that way.
No, and the other thing is you want to know about your products in terms of knowing that a place like ours makes sure that the products we're using have gone through certain steps to make sure that the constituent that we're looking to effectuate the change is in that product and not just fillers and not all these other things. There's a lot to think about. Treat your food like medicine. Well, that's exactly what we do. It is medicinal.
We are coming up on our halfway point of the show. Time flies when you're having fun. We always say that. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is our number here in the studio, 855-839-1210. We still have plenty of time to take your calls and hopefully solve some of your problems. 855-839-1210 is the number. Again, Health Watch is the show, Sundays 8 till 9, Talk Radio 1210 WPHT. Dr. Molly and I return with more of today's Health Watch after these words. Watch, and again, operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. When you call, all you have to do is just schedule that initial consultation with Dr. Molly, and you will really see, and you will learn a lot about the clinic and about Dr. Molly and about how she can help you potentially with any of the problems that you're having. So you want to do that. Schedule the initial consultation with Dr. Molly, and again, it's complimentary, 856-489-0505. 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We are going to the phones, and we're going to talk to Frank in Northeast Philadelphia. Frank, good morning. Welcome to Health Watch.
Good morning, Frank. How are you?
Good morning, Dr. Molly and John.
Hey.
And Mayor Joe from G-Town. I was going to call in after the halfway point. I haven't heard from you for a while. I was going to say, Mayor Joe from G-Town, call in. I'm glad you're doing good, my friend. And also, Doctor, my last week, that first-time caller challenge, the lady after me, you sounded great. Call back. Your energy, you're funny, you're witty. Call back again. But, Dr. Molly, thank you for your recommendations. I got everything yesterday. And,
good, Frank. Oh, you got everything we sent out for you. Good.
Yes,
God bless.
Yes.
I'm sorry it took so long. Man, it's because I'm short-handed, my friend. I'm short-handed.
No, thank you. I really appreciate it.
Okay.
How does this sound, Dr. Molly? My friend from South Philly brought me stuff yesterday. He told me drink this, so I did it. I never did it before.
What?
Raw
what
egg.
Wait a minute. What the heck did he tell you to take?
Oh, I'm going to tell you.
Oh, okay.
It's
good.
a raw egg mixed with milk, but I use almond milk like a dairy problem. So almond milk, a raw egg, and some cinnamon.
Mm-hmm.
He said the eggs for the vitamin B, the cinnamon for inflammation, and just almond milk just to make it like a milkshake or whatever.
Yeah.
Is that true?
Well, listen, I don't think I could take it. I'm going to tell you that right now.
Neither could I.
The
No.
raw egg would do it for me,
No.
okay?
Why drink a Rocky style?
Hey, listen, you know, I worry about anything raw. I'm going to tell you that right now. Because I just feel like, you know, that's a lot. Frank, God bless you. You were able to get that down. I know you're a trooper, but I don't know. How did you feel after you took it? I guess that's the question.
I tried to get Rockies. I just guzzled it. It took me 18 minutes to make it. It was like, I don't see what I'm doing, so I have to be real careful.
Yeah. Well, you know what? I don't think one thing I can tell you is that, you know, I'm a little hesitant on raw food anyway. All right. And that I worry about, you know, things that go into our body that isn't, you know, I understand eggs are well pasteurized, et cetera. But I just worry about any raw that goes into our
Dr. Molly,
bodies.
is there a raw egg more nutritious than a cooked egg? Is there a difference?
Yeah, well, yeah, I guess. Okay, I guess. Look, Frank, I'm not going to tell you don't take it. God bless you. And I'm not going to tell all the wait a minute. I'm going to get battled with a group of nutritional experts that only believe in raw diets. So I don't want to go down that. All I can tell you is if it works for you, do it. That's what I tell everybody. If it works for you, do it. It's not something we would do in our clinic. That's what I'm going to tell you.
It was
okay?
the first time I did it. And also, Dr. Molly, like the vitamin D.
Yeah.
I was listening, but I remember last century, way back when in nursing school, a long time ago. They told us about not just vitamin D, but A, D, E, and sometimes K can build up in your body and be toxic.
Yes. That's why I
so
said.
true?
That's true, of course. One of the things I always talk about, Frank, is that I believe in Goldilocks, just right, because you can have too little of something or too much of something, and it runs the gamut of always giving you side effects, right? If you have too little, it doesn't work, let's say, on the autoimmune. If you have too much, we then add a whole layer of conditions that can occur because of the overabundance of a particular nutraceutical. So again, you know, you've got to do the research. You got to make sure it's right for the particular patient. And, you know, I like it to fit in all the orals that we use. I like to fit in with what we are doing through the hydration, because again, I don't want to give too much to anybody, but I certainly want to effectuate the change. Does that make sense? That's all. God bless you.
And John, at the end of the program, add in Fantastic Frank at the end of the program, too.
Okay.
You got it.
Thanks, Dr. Molly.
All right.
Thanks
For the call,
Bye-bye.
Frank.
That was an interesting call.
Yeah, we should have a segment called Concoctions
Yeah,
that people come up with.
Well, it's a good time of year, right? Because
Yeah.
it's, you know, we have alchemy going on right
Yes,
now. So
yes.
yeah, I have no charge on that. If people want to do a raw diet, go ahead. But it's not, certainly isn't for this Italian girl.
Me neither.
Okay.
855-839-1210. That's our number here in the studio. If you want to call in with a medical challenge or you want to just ask a question of Dr. Molly. We want to talk about subclinical use of LDN.
Well, actually, LDN is the subclinical use. It's naltrexone. And everybody out there knows that naltrexone was around for a long time, and it was used really to help opiate and heroin addicts. And it blocks receptors on the opioid hormones, making it easier for the drug-dependent patient to get off their opioids, etc. But back in the 80s, and this is interesting, in New York, a wonderful a physician who actually knew my physician who helped us start this clinic, because we've been using LDN, low-dose naltrexone, since that time. As a matter of fact, over a year ago, I gave a very large group of physicians a lecture on how to use LDN. And when we use low-dose naltrexone, we're using somewhere between 3 milligrams, 4.5 milligrams, as high as 6 milligrams. When they were using this for opioid dependency, they're going to 50 milligrams and up. So you can see the difference. But one of the things that came up is, why do we use this in autoimmune related conditions? And when we talk about autoimmune conditions in our particular facility, my physicians and I, we talk about things like autoimmune cancer and conditions that involve immune dysregulation. That includes neuro dysregulation. So we found that LDN benefits our particular patients, in particular because we have unique IV protocols that we're using targeting specific types of challenges, physiological challenges for particular diseases. Does this make sense?
Yes.
Okay.
Yes.
So one of the ways that LDN works, it promotes T cell regulation. And the T cell regulation is the immune balance that turn inflammation on and off depending on what's needed. And you remember me talking last week about cell communication. So obviously LDN has a part in that, okay? And it helps people with overactive systems that have things like autoimmune conditions. And I've seen this work very efficiently in things like asthma, autoimmune conditions like Hashimoto's even. So, I mean, this is one. It targets the T cell function. LDN temporarily blocks the opioid receptors in the brain, okay? And so what happens then, as time goes on, LDN goes out of the system and the receptors are unblocked and lead essentially to a net increase in natural opioid. You're hearing what I'm saying? You're not taking opioids. It's your own opioid production. Now, how does this? It's wonderful with people who have low levels of these opioids that come about from the white cells. The white cells then drive the immune response because the cells have opioid receptors. So I'm talking about something like the lock and key that we talked about last week. Okay, they can be influenced by LDN. So this is an important tool in immune re-regulation. You have a question?
No,
Jeff?
no.
It's crazy. It's crazy.
This is fascinating.
So why is the blocking of opioid receptors good? Because by blocking the opioid receptors, LDN blocks something called toll-like number 4, receptor 4, that's found on the white blood cells. This works on the central nervous system immune cells that produce inflammation, pain, fatigue, sleeplessness, mood, cognitive problems, right? When they are chronically activated, they are, as they are in fibromyalgia and other pain disorders, it results in neurotoxicity, something I talk about all the time, and a cascade of symptoms which are usually involved with these conditions. So you can see by using the hydration and actually improving your white blood cells function and utilizing the effectiveness of a low-dose naltrexone, we can actually help reduce side effects from these conditions without interrupting some of the other mechanisms that are going on. It's a little complex, but not really. If your physician is using LDN to treat you, generally they have it made from the compounding pharmacist. And what happens is that usually they're taking it in a capsule, or sometimes they're taking it in a pill form. We found that hasn't worked very well for our patients. We use it in a different form, and I got to tell you, it's really knocking the socks off on our patients in terms of them really going after their goals, and it's more effective when we use it with things that we're doing to help, using glutathione and other things that we use in the IV. So what we're doing is we're enhancing the action of the LDN.
We are coming up on our final break of the morning. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is the number here in the studio. We still have time to take a couple of calls. If you want to jump in here with a question or a medical challenge for Dr. Molly, 855-839-1210. It's Health Watch, and I'm your host, John DeMasi. Dr. Molly and I will return with more of today's edition of Health Watch after these words. We're back here on Health Watch. Operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505, 856-489-0505. And they will be there well after we leave you at 9 o'clock. Look, they don't go home, and they don't watch the Eagles game. Come on. They're there for you. 856-489-0505 is the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show right now, I mean, you'll hear it again. We come back at 4 to 5, the Health Watch replay. We call it the Sleeper Special. 4 to 5, right here on Talk Radio 1210 WPHT. 855-839-1210 is the number here in the studio. And if you have a question or a thought for Dr. Molly, feel free to call in. But at this point of the show, we usually go over some patients and their progress. And this is an interesting case, Dr. Molly, because you brought it to my attention because it was something that I went through many years ago.
Exactly.
This a gentleman who has started with you, and he had bladder cancer.
That's right.
And really, the treatment was what you said. It was questionable.
It sounds like he's in for a whole lot of heartache. But I will tell you, he's a very thinking guy. He had the tumor removed. Very similar case to you, John.
Yeah, right.
He had the tumor removed. But they insisted that he probably would need chemotherapy. I've got to say, I remember that the bladder cancer is what drove you to us.
Right.
This is how long ago that this was. And I remember having lengthy discussions with you, and indeed that we had to worry about the bladder cancer to kidney issue.
Yes.
But I also remember that I put you in touch with a wonderful surgeon. You went to a very good surgeon, high end hospital. We got you to where we were going to. Unfortunately, we did have a problem with the kidney as well, if you remember part of that, because I was there with you through the ER.
Oh, boy.
Oh, boy, we were there for quite a while.
That's
and
right.
He was a mess. I had to encourage the triage nurse to get him in under this particular physician's service, which he did. But the point I'm making is, you manage now, I bet you it's 20 years without a reoccurrence. And as I remember, you've gone back to the urology people. You've been seen by the kidney people, and everything has been going great. Utilizing the way that we do this, you cleaned up your diet, right? You cleaned up, and I have to say, John's a bon vivant. He had to clean up his nightlife a little bit, and because he's well known. And what happened is we got 20 years where we're, thank God, you're cancer free. But you are also very diligent about coming in for the cancer supportive therapies.
That's right. And the interesting thing about this patient who came to you a couple weeks ago is that they recommended chemo
right away.
And I never was recommended chemo. They never brought that up.
No.
And I managed I went back to them because it came back. The tumor came back.
That's right.
And after the second round, the surgeon said to me, we can do something. And they did this, what they call a wash.
I know all about it. If you remember, I told you all about it. It was a very interesting wash. And I will tell you that I'm working with this gentleman, with my docs, but he is vehemently against the chemo, and I think we're going to try to help him not do it if that's what he wants. But obviously, we want to see the rest of the records. He's brand new. And, listen, I have a great medical team. I have a great medical director. We will sit down and say, this is the direction we're going in. Right now, the patient has to call the shots. Risk versus reward, okay?
Right.
And he said, I just can't do it. I took one treatment. I cannot do it.
That's right. We also want to talk about the Amish patient who is getting surgery this week.
Yeah, he's getting surgery on Tuesday. This is an interesting case. I told you he came to me with infection in his foot after having 3 surgeries, heavy metal put in his foot. He had a terrible accident. we were treating him with both natural products. First of all, he was emaciated when he came in because he couldn't eat because they gave him 6 weeks of antibiotics that I don't know what they were doing because the culture came back with a different antibiotic in terms of what we were giving him. So we put him back on the antibiotics. We gave him the nutrition. We reached out for the surgeon. The surgeon is finally going to be doing the surgery this week in the hospital where it has to be. And he's probably going to have a 3 to 4 week recovery with us here in New Jersey before he goes back to Indiana.
And we have a couple other. This was an interesting case, depression and a concussion.
Yeah. Oh, yeah. I had a young man a couple of weeks ago. You remember me telling you he had depression. He was like 18 years old or 17 years old. Sent him home. We followed a protocol for the depression with neuroamino acids, some vitamin-specific types of vitamin B, and also I used something very interesting in a laser kind of thing, and he's doing so well. He and his mom called me this week and said, my gosh, the anxiety is really way down. He's not on any anti-anxiety because the pediatrician didn't want to put him on. Our consulting pediatrician said, let's try to look at this from a natural point of view, and that's what we're doing, and we're keeping close tabs on him.
Oh, real quick, appendix? The
appendix cancer. That's so rare. He had a situation where he went in excruciating pain. His appendix had burst. He's brand new to us. The appendix burst, and apparently in the bursting of the appendix, the cancer cells, of course, were released, and they're very concerned about it going elsewhere. So we are doing our cancer supportive therapy along with whatever he's doing with the chemo, and at this point he said he's looking for trials, and we're trying to help him get into a trial if that's what he wants. But I do believe it's really necessitated, like you're a good example of staying on a cancer supportive treatment to hold down some of this.
Yes. And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock. They're not going home. 856-489-0505, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget our Health Watch replay this afternoon, 4 to 5, right here on Talk Radio 1210 WPHT. For everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Lana, Donna, Jess, Jim, and of course there's Joanne, delightful Dee, fabulous Fran, and our medical assistant Sandra. I'm your host, John DeMasi. Thank you for listening. We will talk to you next Sunday, 8 till 9, Health Watch, right here on Talk Radio 1210 WPHT.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.